This is the first session, session 1, Plenary Podium, Insights into Neural Pathways. And I'm Senator Hirschhorn from Canada, and you met Carlos D'Ancona from Brazil. The first paper is the Prize Award Best Basic Science Abstract, entitled In Vivo Imaging of the Neuronal Network of the Lower Urinary Tract Using DTI Fiber Tracking, a Pilot Study. Dr. Wöllner.
So good morning, everyone. Dear Chairman, dear colleagues, I hope you enjoy and recover from the nice samba session yesterday evening. I do. So I will present now our data of in vivo imaging of the neural network of the lower urinary tract using diffusion tensor imaging. So I have no disclosures. So what was the background about this study? So we know all that a neural network engenders an unaffected function of the lower urinary tract, and especially deterioration of this neuronal network as a consequence of spinal cord injury or other systematic neurological disease can affect the integrity of these nerve fibers and can lead to dysfunction, especially to neurogenic lower urinary tract dysfunction. So the question was, what happens to the nerve, especially in spinal cord injury, in chronic disease? Is there a kind of nerve degeneration, or what happens? And that was the idea for this study, to apply this DTI technique, what is used in the central nervous system, to go down to the pelvic region and to test and to evaluate if it's feasible to image the neural network. So the material and methods, it was a prospective investigator-initiated pilot study. We get the ethical approval. We used the Philips 3 Tesla MRI for this investigation. The total scanning time was 25 minutes, including calibration, including the anatomical scan and the DTI high ISO measurement. So we sized the voxel size of 3 to 3 millimeters with a slice thickness of 3 millimeter. Down is the algorithm we chose for the two different measurement methods. As I show here in the upper pictures, you see our measurement method. We choose a 3D evaluation of the fiber tracts on the left-hand side, down from the roots L1, L5, S1, down to the pelvic region to track all the fibers, and in the same manner down from the pelvic region up to the sacral roots to track all the fibers. And on the slides down, you see a different technique what was mentioned in the literature by Hakmar and Van Eyck and colleagues. They decide to define region of interest and track all the fibers connecting this region of interest. We do this in the sacral cord as well in the bladder region. To our results. So overall, we include 17 subjects in this study, 10 healthy volunteers, 5 female, 5 males with a mean age of 44 years, as well 4 patients with neurological disease, 3 with spinal cord injury, and 1 patient with a myelomeningocele. We have to exclude 3 subjects from further analysis due to moving artifacts. So we measure with a 3D method. On the above side, you see that is the all fibers or all lines we tracked in this 3D manner. We do not see any differences between the healthy volunteers and the patients. On the left-hand side down, that is the FA, that is a value, what is described in the literature for the directivity of the nerve fibers. And we see a very lower value in the healthy than in the patients, but it was not significant due to the small sample size. On the left-hand side, the ADC is a value for the integrity of the nerve fibers in one observed voxel, and we see, as described in the literature, a lower value of the ADC in the patients compared to the healthy volunteers. Applying the multi-Roy technique in the sacral roots, we tracked lower amount of lines in the patients than in the healthy volunteers. Regarding the FA, we see a similar result, and as well the ADC was lower in the patients than in the healthy volunteers. Looking or applying this multi-Roy to the bladder region, we as well tracked the same amount of lines in the bladder, whereas the ADC was similar, lower in the patients. That is my first video loop because it's easier to image or to show this video network with this video loop. You see the bladder in front, the green lines, the network surrounding the bladder, and you have connections. You see it on the right-hand side to the sacral cord. You can see here the bladder is surrounding here, and here are the sacral roots originating from the S2, S3, and here the connection to the bladder tissue. This is patients with chronic spinal cord injury. As well, the video loop you see down here. The bladder is around here. This is the connection fiber to the sacral roots. It's a thin connection. Here's the sacral root S3, S4, and on the other side as well. And you see also here small connecting fibers down to the bladder tissue. And from the dorsal view, you can see the sacral roots. This is an interesting case because that was the patient with the spina bifida, and what you observe, you see on the right-hand side the sacral roots in a normal organization, and on the left-hand side over here you see a defect. There is only a thin connection between the sacrospinal cord and these roots. Only a few fibers were able to track there, and that is in all directions, all views we tested. We saw this defect corresponding to the underlying disease. Now we zoom into the bladder. It's a very thin or very huge network and going down to the anal sphincter. And now my last video loop, this is also to image here the network going down to the bladder, that you see the connection from the sacral roots connected with a thin or widespread network to the bladder innervation. You see it on the left-hand side there. So my conclusion is, we think it is able to do an in vivo imaging of the neural network of the lower urinary tract. We applied these two algorithms I mentioned in the beginning of my presentation, and we get reproducible results in the healthy volunteers as well in the few patients. We observed a very, very close network depicting very high innervation density of the lower urinary tract. We get similar results applying the 3D method comparing to the multi-ROI method, and we thought it is a promising tool to increase our knowledge about the physiology as well the pathophysiology of the lower urinary tract and its dysfunctions. Thank you for your attention.
Thank you very much. This paper is open.
From Utrecht, the Netherlands. Good morning. Roos here from Utrecht, the Netherlands. You show very nice pictures. Congratulations with what you did. And you refer to one manuscript in neuroimaging. And I miss those structure that you see in the lower abdomen on that publication, as well as in a very recent publication in urology. You must have seen that. And compared to the picture that you show in the abstract, it's much more easy in their pictures to see the sacral roots, and they missed that structure that you see in the lower abdomen. What did they do wrong?
I think we started with this study 1 year ago, and I think it is a very, very difficult approach to do this. So the paper from Hagma published in Urology, so they only tracked the sacral roots. And as we do as well, so I cannot show all the pictures, but we get the same results if you only track the sacral roots. You get very nice pictures with very thick nerve fibers, and it's much clearer than the pictures I present you here. But my interest was to see the connection between the sacral roots down to the bladder and to image the bladder. And the problem is applying this multi-ROI approach, what von Hagma and colleagues do, it is nearly impossible to get all nerve fibers in the pelvic region because they're very widespread, small fibers. That is a problem. That is why we choose another method, to get more fibers. It's not so nice pictures, not so clear pictures. On the other hand, we want to show or to apply to the anatomical view, that we can say, okay, that really are nerve fibers, because with the computer you can do everything. But that's why our pictures are not so nice. And we are still in the beginning, and there is a lot of work to do to improve it. It's not perfect, but I think it is the first step, and we are proud to get these pictures and to get this result for the 10 first patients. But it's not the end, and we have to do a lot of work, I think.
Jalesh Panikar from Queen Square in London. Congratulations on those producing those vivid images. My question was regarding the resolution of your technique with identifying the large nerves, such as the pudendal nerve and its branches, as compared to the small nerve fibers of the pelvic plexus. Are they comparable with regard to resolution using this technique?
So we applied in all subjects, as well as the healthy, as well in the patients, and as well for all the reasons we applied the same technique. We try for 6 months to get the best algorithm to get this tracking. And then we choose this algorithm I mentioned in the beginning, and we apply this technique in all subjects for all analysis.
Thank you.
Charles Powell from Indiana in the United States. Could you go into a little detail about how you objectively quantify the differences in the nerve density? Those are wonderful pictures and exciting work. I'm just curious how you mathematically compare the two.
I think in the moment we are not clearly able to state or certain clear differences in patients as well in healthy volunteers. I think there is a tendency to see lower, or as well in spinal patient with a spina bifida, you see a lower innervation on the left-hand side. But currently we have no method or no really good method to quantify it and to see, okay, there are the differences. I think we have to go on and to develop this.
So with all these images, you can construct a atlas, and you can show what's normal and abnormal, and what things we can influence in the clinical practice.
I think the issue is, for the first step, first to images and to see differences. I think one problem of this technique is you get no information about the functionality of these nerve fibers. Because you can only image, you can see there's a defect, but you have no information. And that's why we try to combine this with neurophysiological assessment in the future.
One last question.
Yeah, Lawrence Stewart from Edinburgh, UK. I may have missed it. What was the significance of the different colors of your fibers?
So the colors describe that the standard procedure, the direction of the nerve fiber, the head to foot, left, right-hand side, and that is, you see the direction where the fibers go. That were the colors.
That's it. Thank you.
Thank you very much.
Thank you.
Thank you.